One Monday's bad enough.
That just means it's oversat.
Yeah.
The next one.
Yeah, I knew when my wife said, take out the garbage. The week is short. Are we ready? All right, well, good afternoon. We'll begin our 5 o'clock briefing on the COVID updates for September the 10th. And the numbers that I've seen and that you'll hear, again, are encouraging. And we're staying the course, and we appreciate that. And so the cool weather is a very nice break in the heat that we've had, and we appreciate that too. So that makes it wearing a face mask a little easier. But we'll call on to Peter to give us the numbers to date. And then Annette Rodriguez with the Health District will be giving her presentation, and the county judge will be here, and I'm not sure whether she'll be here WebEx or in person, but she is scheduled to make a presentation. Is that correct? I think that's the information I had. Okay, so Mr. Zanoni, if you'll come, and then Annette, and then the county judge. County judge.
Las cifras que hemos visto nos dan ánimos ya que han mejorado mucho. Ahora el administrador de la ciudad, Peter Zanoni, nos va a dar su reporte, seguido por la directora del Distrito de Salud Pública, Annette Rodríguez.
Hello. You doing good? Good. Okay, good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager, and I'm going to provide you with an update on the statistics for the day, so the number of new cases to report. We'll also talk to you about hospitalization, the change there, and then also number of deaths for the Nueces County area. So we do have several visuals. The first one we'll show you is the number of new cases for Nueces County. This is a 2-day graph that shows you day by day number of new confirmed positive cases. And you can see for today, the 10th of September, there's 21 additional new cases for today. If we look back at the last 7 days or so, we're lower than we were a Thursday ago on 9/3 over here. We had 30 that day. Today we have 21. So Thursday over Thursday, a little fewer. You can see some high points of 92, 50, 47, and then several in the 20s, which is good. We like this better than the 200 and 300s. And the 7-day average is 37. So if we look at the past week, that average per day is 37. So 21 is less than our 7-day average, which is a good sign as well. This next graph shows us the daily number of new cases, and it also shows in yellow the number of state data drop cases that we have been receiving. And today, by the way, we did not receive any data drop cases from the state. So just the 21 from our health district for today. So you can see the same 2-week trend line to include the numbers that we received from our health district, and then the yellow ones are the ones we received from the state, from data drops, we call them. We do assign those once we get them on a particular day. We assign the number of cases to the day in which they were confirmed to be positive. Okay, and then this next graph gives us a little more perspective. It goes all the way back to June 1. This shows the number of daily new cases in blue, and then on top you can see in the yellow the number of state database received numbers, and those are the appropriate numbers for that day. It's not the data drop number, but it's rather the number of new cases confirmed by the state and reported to us. All right, and then our next chart here is what we refer to as our donut chart, and this shows the number of active cases as compared to the number of recovered. And we want that active case, which is shown here in the blue purplish color, we want that number to be a smaller percentage, right, the active cases, and that's what we see today. So 85% since we've been tracking COVID of all persons who have come down with COVID have recovered. That's that 85% number, which is shown in orange, which is a little over 16,000 persons, 16,204. And then the blue, the number of active cases in our community is still pretty significant, right? It's just under 3,000 persons are still in that positive state of COVID. So 2,922 to be exact. The chart also shows the number of deaths. It's been 383 deaths since we've been tracking this, and we'll show you a chart on that towards the end of the presentation. Okay, so let's talk about hospitalizations. This graph shows us over time the number of persons in the hospital who are recovering. And you can see we have a slow decrease over time, which is good. Today, there's 99 persons in the hospital who are recovering from COVID-19, and that is 13 fewer than yesterday, which is good. Yesterday, there was 112, and today with 99, reduction of 13. You can see on the graph, it goes all the way back to August 28th, and back then we had 164 persons in the hospital. So it's slowly coming down. We hope it stays this way, and in fact, we hope it decreases even further. Okay, and then of that number, of the 99, 36 persons are needing more intense care in the hospital than the normal patient. So 36 persons are in ICU today. And that also is fewer than yesterday. There were 39 persons yesterday recovering in ICU. Today there's 36, so 3 fewer today than yesterday. And then the number of deaths, we talked about there were 383 since April when we first had our first death in the community. Yesterday we had 382, so just one additional death to report today, which is great in terms of a lower number than what we had been reporting a couple of weeks ago. It was almost a daily amount of 10, 15 persons per day, so one additional death today to bring us up to 383. Okay, and then the final graph is our trend chart that shows two things. One, the number of daily cases in the blue lines, so blue bars. And then the red line shows us the 7-day running average, the daily count, the daily number when you look at a 7-day trend. And that's shown in the red line, and then the blue is the daily count. So you can see around mid-July, it was around July 15, is when we hit our peak in this latest and significant wave, and we've been slowly coming down. There was some coming downs and slight going back ups, but we're down here at 910, much lower than what we were back in July, and not quite where we were before the outbreak most recently, but we're getting there. So, okay, that concludes my part of the presentation. We're going to have Annette Rodriguez, our Public Health Director, come up and talk to us a little bit more about COVID-19. And between that, Gabby's going to translate some of this into Spanish for us. Thank you.
En las últimas 24 horas se han reportado 21 casos por el coronavirus. En los últimos 7 días los casos positivos han disminuido, lo que son muy buenas noticias. El promedio en la última semana es de 37 casos. 16,204 pacientes se han recuperado por completo. 99 personas continúan en el hospital. De esas personas, 36 están en la unidad de cuidados intensivos. 2,922 personas aún están con casos activos. El día de hoy se reporta un fallecimiento. A la fecha, los fallecimientos totalizan 383 personas. El día de hoy no recibimos casos positivos por parte del Estado.
Good afternoon. Annette Rodriguez, Public Health Director. The Health District conducted a drive-through yesterday. 23 individuals were tested and 5 were positive. This gives us a positivity rate of 21.74% from this particular cohort, which is still very high, but we also realize that the number of people being tested is decreasing, and that's a good thing. We continue to see a downward trend on the number of positive tests in the Coastal Bend. Again, a good sign for all of us, and we must continue to decrease the cases in our area. As more of our community and business are opening, you may be looking for ways to resume some daily activities as safely as possible. While there is no way to ensure a zero risk of infection, it is important to understand potential risk and how to adopt different types of prevention measures to protect yourself and to help reduce the spread of COVID-19. The risk of an activity depends on many factors, such as being around one or two family members is less risky than being around large crowds of strangers, which comes with a lot more risk. Being around people wearing masks and social distancing is less risky than being around people that are not wearing masks and not social distancing, which comes with a lot more risk. Being around someone that's not wearing a mask for only a few seconds is less risky than being around someone that is not wearing a mask for a long period of time. It is important for you to consider your own personal situation and the risk for you, your family, and the community that you're venturing out into. In general, the more closely you interact with others outside of your bubble, outside of your family members, and the longer that interaction, the higher the risk of COVID-19 spread. If you decide to engage in public activities, continue to protect yourself by practicing your everyday preventive actions. Keep these items on hand when venturing out: a mask, tissues, and hand sanitizer with at least 60% alcohol, if at all possible. Today, we received a cold front and lower outdoor temperatures. Cold fronts can also bring allergens. Allergies and COVID-19 have a lot of similar symptoms, such as fatigue, headaches, sore throat, congestion, or runny nose. If you are experiencing symptoms, schedule yourself for a COVID-19 test. It is better to get tested than to just assume that you have allergies and go about your business as if there was nothing wrong. During this current time, anyone with any symptoms needs to isolate themselves from others. Please do not be a super spreader and spread germs to other people. Always remember to practice the 3 W's. Number 1, wear a mask. Number 2, watch your distance, 6 feet or more from others. Number 3, wash your hands as often as possible. None of us have a crystal ball. There's much uncertainty as to what the flu season will bring. But what we do know is that we had a really tough summer when respiratory illnesses normally spread more easily during the wintertime. So follow CDC recommendations, get your flu shot. Sometime next week would be great so you can have some protection against seasonal flu that starts officially October 1st, 2020. The Health District continues to conduct syndromic surveillance and has already been notified of our first case of seasonal flu and COVID-19 co-infection, and the patient had to be hospitalized. We must all do our part to minimize these infections. Stay home during flu season if at all possible. Stay well, stay protected, and as always, stay informed. Thank you.
El Distrito de Salud realizó ayer la toma de 23 especímenes, de los cuales 5 resultaron positivos a la presencia del virus, lo que hace una tasa de positividad del 21.74%, tasa la cual aún es alta, pero el número de personas interesadas en hacerse la prueba ha disminuido. Las actividades continúan reanudándose en nuestra comunidad, por lo que es importante tomar medidas precautorias para evitar contagios. Algunas de las actividades de riesgo son estar alrededor de personas desconocidas, estar cerca de personas que no usan cubrebocas o practican el distanciamiento social, estar cerca de alguien que no usa un cubrebocas por largo periodo de tiempo. Cuanto más interactúe con personas fuera de su círculo familiar, mayor será el riesgo de propagación del virus. Si decide participar en actividades públicas, continúe protegiéndose practicando las recomendaciones sanitarias. Hoy llegó un frente frío y temperaturas exteriores más bajas. Los frentes fríos pueden traer alérgenos. Las alergias y el COVID-19 tienen muchos síntomas en común, como fatiga, dolor de cabeza, dolor de garganta, congestión o secreción nasal. Si tiene síntomas, programe una prueba del COVID-19. Es mejor hacerse la prueba que simplemente asumir que son alergias. Recuerde, la temporada de gripe comienza pronto y es aquí cuando las enfermedades respiratorias se propagan más fácilmente. Si no se ha vacunado contra la gripe, ahora es el momento de hacerlo. Así aminorará su riesgo de enfermedad, la cual pudiera empeorar si también llega a infectarse con el coronavirus. Use un cubrebocas, practique el distanciamiento social y lávese las manos seguido.
Thank you and good afternoon. Barbara Canales, Nueces County Judge. I trust that everybody had a very safe and relaxing holiday weekend. And before we get into our COVID updates and information, I wanted to just spend a few minutes to discuss Bob Hall Pier. And of course, you know that it was severely damaged by Hurricane Hannah. And because there's been a lot of misinformation, I wanted to take a little bit of time today to correct the record. We are still at the county in the evaluation phase of the project, and we do not have any concrete numbers or final analysis yet. To be clear, this is a three-step process. This process begins with step one, which is the initial evaluation, and this, of course, is always performed very quickly as part of our emergency management initial damage assessment. A report is then sent to the state of Texas. This part is complete. And while that assessment came with a cost estimate and a recommendation whether we should repair or rebuild, it was an initial damage assessment. It was an idea, a very educated guess in order to make certain that that number, along with all other damage assessments inside the county, including the city of Corpus Christi, and from every other affected counties put together, lets the state of Texas tell FEMA whether or not we think our state has met the threshold to qualify for federal disaster assistance. This is, again, an informed estimate. It's not a final assessment. The state of Texas did meet the threshold needed to qualify for FEMA, which is good news, or we believe that this will be forthcoming, this announcement. But repair or replace, federal funds should be available to us. Now, step two is really a full assessment by engineers. They will tell us exactly how much of that pier will need to be replaced or repaired. And of course, that pier is just one element, correct? There's also attached buildings and ramps and an associated parking lot. And they're going to focus on how much exactly that will cost for repair or replace, whichever is deemed necessary. And this is exactly where we are today in step two. And the best way I can explain it to everybody is that it's no really different than the way we go through the repair process of a car that has been in a terrible accident. And sometimes on first inspection, a technician might need to look a little further into the hood, needs to dig a little deeper to understand the full extent of the damage. And I can tell you that based on preliminary step one assessment, that engineers can see that some of the pilings have visible cracks. And we are now in the process of doing that thorough engineering assessment to inspect and take core samples of the pilings and beams for structural integrity. Accessing those pilings has been challenging, and it does require removing the concrete panels that form that deck that you walk on. And as a matter of fact, that process began today. Divers and drones have also been at work collecting images, both from above and below the water, and including the underside of that pier. And all of this data is in the process of being analyzed. It has been collected, there's collection going on, and we're in the analysis process. And this final assessment should be complete by the end of September, which is a very good thing because we have till September 29th to get these numbers to FEMA. Now, step three is using all of the numbers and all of the engineering analysis and reports and cost estimates, which actually determines whether or not we need to replace the pier entirely or repair it in sections. And again, let's go back to that car analogy. If we were getting our car repaired after a major accident, like we had a major incident with Hurricane Hannah, there is a point at which the cost of repair is so high that it approaches the value of the car. And then what do we say? That car is totaled. And so I want you to use that analogy in thinking about this pier, and because even in the car scenario, if you had a car that was 10 years old, you've got to compare that repair cost to the value of that 10-year-old car. And we have a 1983 pier, so we're going to be comparing it using age as a factor. And so if it exceeds 50% for this 40-year-old pier, to replace it with a brand new pier, it's going to be considered most likely, more likely than not, a total loss. And the actual replacement cost becomes our official damage estimate. So when FEMA gets involved, no matter what, repair or replace, they will reimburse 75% of the cost to do that work. And the state of Texas and other agencies sometimes will have additional funds to assist, or they will come from local matches. Look, the point is that we do not know as of today the true extent of the damage for certain, and we need to be patient and wait for the full engineering assessment. Until then, we're going to continue to update you, and through this medium and other medium platforms that the county has. And we know how important this pier has become to our community, to our local culture, and we want that to continue. And so I'm going to, again, thank you for your understanding as I present this information. It is as up-to-date as I know it, and crews continue to work in the area. As a quick little update, right before I came here, I saw an email that came from the General Land Office that we are 60% now clear and clean from that parking lot around Bob Hall Pier and Michael Mays. So we're making tremendous progress. If you want to know how much debris they move a day, 24 truckloads to the landfill a day. It's a tremendous amount of volume of debris. And again, just because I'm here to talk about safety and security of our community, please make sure you're observing all those caution signs, and please stay out of the closed areas. The restricted areas are there for our safety. It allows work to be done, and it's very important because if we get that work done, we can reopen as soon as possible. So, switching to the perpetual disaster that we seem to be in with COVID-19, this morning we had a moment of what I call a rainbow effect. And the rainbow effect for me in my world is when I see something that really brings optimism and a sense of preparedness, because it's such a happy thing to see after a rain, that rainbow. And COVID-19 has brought a lot of gray skies to our community. And the rainbow today was when I spent some quality time this morning at Christus Spawn Shoreline with Dr. Osbert Blow, CEO, and representatives from the International Medical Corps. They were there at Shoreline facilities to demonstrate an emergency field unit. It was a very impressive tent, and tent is really a poor description. It is complete with air conditioning and electricity. This unit, it gives us the ability here in Nueces County to treat any type of overflow of patients in emergency situations, such as our current pandemic or even a major storm. It's going to be excellent for triage, for waiting, for testing, for any type of event that might need to necessitate extra space. What I was not able to do was to see all of the tents that were brought to our community through the Christus Spawn system. There was an assembly this morning at Memorial Facility, Christus Spawn Memorial. There was also one at Christus Clayburgh in Kingsville, another in Christus Jim Wells and Alice, and yesterday there was a display of the same type of field unit in B. So all the Christus systems serving our regional healthcare center had one of these field units. And while we don't anticipate needing this field unit in the near future, we are ready. And I think that's what we all want to know, that we are ready and prepared to handle any situation as they arise. And because of Director Rodriguez's comments about flu season, we must be ready. The International Medical Corps, for those of you that don't know about it, is an amazing organization. It's dedicated to emergency relief and training all over the world, from disease to war. And those that are struck by disaster all over the world have received, since 1984, the help and aid from the International Medical Corps. There will be supporting our local medical staff in the fall who are dealing with COVID-19, and we are grateful to have them. And so as we close out another week of, I suppose, living with the after effects of two disasters, we remind all of you to stay safe and remain socially distant and especially vigilant about wearing your masks. I'm constantly reminded that everything we do has a consequence. There is such a cause and effect to our actions. And I just want to say that tomorrow is September 11th. And we remember this day in the hearts and minds of all Americans, because that was the day that terror struck at the heart of our nation's financial capital in New York and our government at the Pentagon in Washington, D.C. And the most vivid memories I have of that day, and I remember it well, were images of first responders rushing to help. Many of us remember that famous photo of the New York firefighter, Mark Kehoe, walking up the stairs as office workers were headed down to safety after their tower was hit by a plane on 9/11. Mike Kehoe was heading in the opposite direction. Firefighter Mike Kehoe and his colleagues had the horrific task that day of scaling 93 floors to reach any survivors. The photo was printed a few days later, and Mike was thought to have certainly had died, but amazingly, he escaped with just seconds to spare before the North Tower collapsed completely. When a reporter went to the fire station at the engine company, seen on Mike's helmet, he was expecting to ask about their fallen colleague, but instead, Mike was there on duty. He was asked what it was like, and he said, "Sure, I was frightened, but I was just doing my job, and I wish we could have done more." Interviewed all these years later, he observed that it wasn't different than any other day, that September 10th, just like today is September 10th, and on September 12th, it took a tragedy to show just what the police and firefighters do every day. 2 planes hit the World Trade Center, and we lost 343 guys, and suddenly we were heroes who don't run away. But we had never run away before, he said. We just did what we did that day. I'm definitely no hero. I was just doing my job like thousands of other firefighters. What humility he had. And I just want to say that on the eve of September 11th, we have firefighters here, head of emergency management here, police officers here, and other first responders who are heroes just like Mike Kehoe here in Nueces County. Every day they respond because they're just doing their job. And tomorrow there's going to be a lot of important memorials, and there's going to be a lot of important observances, and we're going to honor those who died, and we're going to honor those who risk their lives every day since that horrible day. And there is a great quote by Lincoln that's usually used for moments like this, and it reads, "It is altogether fitting and proper that we should do this." And so tomorrow I'm going to ask you, as the official here in the county, as we honor them, would you please remember that there are quiet heroes that live amongst us every day, who stand ready each and every day to serve and to protect and to defend us, and yes, to rescue us. And whether it is COVID-19 or a hurricane or a fire or a 911 call, I just want to say how lucky we are to have them in our community as our neighbors, and we owe them such a great deal of gratitude for everything they do and everything they stand ready to do every day. So I'm grateful for the time that I've had with you. We've not coming as often, but we come to try to deal with the important issues of the day, and also to remind all of us that these press briefings are our way to communicate with each of you, and I stand ready to not only answer your questions, but always feel free to contact us at the county with your concerns, and we hope to be able to address all of them. Thank you.
Quiero actualizar información sobre la evaluación del muelle Bob Hall. En la fase 1 fue la evaluación del muelle. Esa evaluación incluye un estimado del costo de reparación. En la fase 2 se llevará a cabo una evaluación más a fondo en donde se sabrá exactamente cuánto costará la reparación. Ahora nos encontramos realizando esa fase. Esperamos culminar con esta fase a finales del mes. En la fase 3 tomaremos la decisión si se realizarán las reparaciones o se reemplaza el muelle por completo. Si el costo de reparación del muelle excede el 50% del costo de reemplazo, entonces se realizará el reemplazo. FEMA va a absolver el 75% de esos costos. Esta mañana estuve con oficiales del Hospital Spawn y de International Medical Corps, en donde visitamos una unidad especial de emergencias. Esta unidad nos proveerá con la habilidad de atender un mayor número de pacientes en caso de ser necesario. Mientras no anticipamos que esto suceda, estaremos preparados para hacerlo. El día de mañana, 11 de septiembre, recordaremos los atentados terroristas. Muchos de nosotros recordamos las imágenes de los socorristas, entre ellos al bombero Mike Kehoe, quien ayudó a salvar la vida de muchas personas de las Torres Gemelas. Muchos socorristas, como los que estuvieron en Nueva York, los tenemos aquí en nuestra comunidad. Así que quiero darle las gracias a todos ellos por todo lo que hacen cada día por todos nosotros.
Okay, that concludes our press briefing for today, and we want to see if there's any questions from the media. Okay, no questions from the media, thank you. So our next press briefing will be Tuesday, and that'll be focused primarily on Dr. Bird from Texas A&M University and his team, and they'll be providing us updates on their modeling for the Coastal Bend community. So we'll see everybody Tuesday. We'll be sharing information on our websites. The city and county share a joint webpage for COVID-19. We'll continue to update that through the week and weekend. We'll see everybody back here on Tuesday. Thank you.